You are listening to a special edition of the BioCentury This Week podcast, recorded live on stage in Cambridge at the 3rd BioCentury Grand Rounds Conference, and first to take place in Europe. Grand Rounds Europe, like Grand Rounds US, seeks to engage thought leaders at the academia-industry interface. Now here's your host, BioCentury's Stephen Hansen.
Welcome to a special edition of the BioCentury This Week podcast. I'm Stephen Hansen, Director of Biopharma Intelligence here at BioCentury, and we are coming to you from the ancient university town of Cambridge in the UK, the original Cambridge, as it were, where we are wrapping up our first inaugural Grand Rounds Europe conference. Joining me to discuss key takeaways from the event are James Sabry, EVP and Chief Business Officer of BioMarin Pharmaceutical, Michelle Jones, Chief Operating Officer at Astex Pharmaceuticals. And then from the BioCentury side, we have our illustrious VP.
Used to be esteemed.
You used to be esteemed. Well, you're still esteemed, but you're also illustrious.
Right.
And Editor-in-Chief, Simone Fishburne. And then our talented Executive Editor and Head of Intelligence and Research, Selena Koch. So thank you, first off, to our sponsors again for a tremendous conference over the past few days. Believe that they achieved sort of the unthinkable in terms of having 2 days of pretty great weather, which I did not think was going to happen, having this in Cambridge in the fall.
I'm so glad, because I thought you were going to say 2 days of pretty good panels, which is totally thinkable.
Oh, they were more than just good. No, yeah. But the weather also seemed to cooperate better than expected. So. But you're right, we also have had 2.5 days of panel discussions, meetings, fireside chats about the future of translational medicine and Europe's role in it. So I think we should dive right in. So Simone, as normal, I'm going to start with you. I would like you to give me, maybe one or two of your key takeaways from this week.
Right. So I want to start with just sort of stipulating to the fact that Grand Rounds is really a very geeky, sciencey conference, bringing together academic innovators together with thought leaders from venture world, pharma, biotech, and more. And so we're going to get into some of the key scientific takeaways. But it's also about an ecosystem here in the UK where, biotech has been growing and growing. And then this conference came on the heels of some sort of big blows to the ecosystem in terms of Merck deciding to withdraw on a $1 billion facility that it was building in London, and followed by Lilly and AstraZeneca saying they might pull back on their presence. And so I want to start with just a little bit of discussion about the general environment here. We had 2 sessions that were really fantastic. We had a debate with Steve Bates, who is the CEO of the BIA, which is the UK's version of Bio, and soon to be some very big director or some big poobah in Office of Life Sciences in the government.
I think Big Poobah is the official title.
Big Poobah, I think, is the official title. And then Jerome van Beverleert from VIB. They did a great debate on whether this is the UK's moment for biotech. I'm going to come to a couple of those things in a minute. And then we had a great fireside chat moderated by Kate Bingham, who, as people will remember, led the Vaccine Task Force, is a premier investor, managing director at SV Life Sciences, and Patrick Vallance, Lord Patrick Vallance to you, who is the Minister for Life Sciences. And I just want to make a couple of comments about my take home on the vibe here. So there's no question that these were kind of big body blows, right? And that definitely there was a need to respond. And I think what we heard, and tune into BioCentury and read it next week, we'll be writing more about this, but the minister definitely gave the message that he has heard, and he plans to convey to the government that he's heard the urgency, the importance of resolving. I think what most people agree, the real problem is around drug pricing, maybe dressed up as a few other things here and there, and Merck may have its own issues, and we can talk about that. But there is a very big need to address that amount of spend in the NHS. We'll elaborate, as I said, on that in another place. But I also wanted to make the point that he talking with Kate and Steve and Jerome, and just the vibe here, it may have been a body blow, but there's still tremendous enthusiasm. Nobody is walking around talking about the death of UK biotech, grossly overstated, as some would say, prematurely announced. So I think there's just, a feeling that that's got to be resolved. But at the innovation level and at the energy level, there's still a lot of value here and people creating value and people believing that they're creating value. And a lot of thirst also for the kind of input and advice that they can get from people like you, James, from pharma or an ex-pharma BD people and from investors. And so I feel like there's still a very healthy buzz here at the same time as there being a kind of like, yikes, what's happening?
Yeah, one thing that I appreciated was that although there was some joyful banter on France versus the UK,
where France did not come out well.
I'm sure the UK would not come out well if this was being held in France. But besides that banter, in the end, I think it was very clear that our industry does really well only when there are wide open borders for talent flow, for capital flow, for global collaborations. And that kind of came out as an underscore, I think, throughout the whole conference.
Yeah. I mean, Michelle, you're sort of our local hero here, sort of maybe the local hero effect. Could you talk a little bit about sort of what your perspective was from takeaway from the week?
Yeah, no, I think it's really great that BioCentury Grand Rounds has come to Cambridge, has come to Europe, but in particular come to Cambridge. I think the Cambridge ecosystem has really been grateful for the opportunity to showcase everything that's going on in this environment. It's a thriving community of academics, VCs, pharma execs, and I think there has been a lot of energy around in the room. I've seen the buzz out in the corridors, and that's been really great to see. A lot of partnering meetings, a lot of companies presenting. There's a real burgeoning life science, in particular biotech community here in Cambridge. And Astex, who's been here for over 25 years now, is really proud to be part of that and to contribute to that. And we have a number of interactions with research institutes across the Cambridge ecosystem. We're part of the Milner, who are one of your sponsors here. We have academic relationships with a number of the academics who were here today. David Klenneman, Matthew Garnett at the Sanger are all academics that we work with at Astex, and some of the companies that they've been spinning out as well, like Mosaic and BaseRx. I'm also minded of the panel before about quantum computing, looking to the future as well. Astex has and also a relationship with a biotech company here in Cambridge called Riverlane, who've been at the forefront of quantum computing. So I think there's a lot of great stuff going on in Cambridge, and I think we really appreciate that we've had an opportunity to showcase that to the wider BioCentury audience.
Actually, can I just follow that with one point? Because one of the things that we have done with BioCentury Grand Rounds, and is part of the kind of what I call the thesis of it, is also to bring innovators and investors from everywhere else. And so that's been a very significant part of the audience. So on the one hand, we've showcased that, but on the other hand, it's been great to see people from Glasgow and Edinburgh and other parts of Europe and innovators from everywhere. And that really goes back to your point that it is about creating, we've always believed at BioCentury, those cross-border connections are what makes this tick. So, I think that's been quite fun to see. And as I said, even against the backdrop of that sort of very kind of what felt like alarming news, you don't see sort of long faces too much, except a few people from Merck had pretty long faces.
I was just going to say, there's certainly lots of positivity on the panels that have all been presented here. Obviously, the ones that were focused on the economics and some of those big, body blows, as you said, to the UK life science industry. But overall, I sense that there was enormous positivity, and innovation and science are really at the forefront of that. And I think the political pressures will be what they will be. But I think as long as everybody keeps focusing on the science, that's really primary importance.
Speaking of sort of the AI and the things there, Simone, I think you also wanted to talk maybe a bit about some of what we saw from the AI and like chemical space and sort of some of the mapping and things. What was your takeaway from one of those panels as well?
Do you want to go first to Selena? That was late.
So this is a geeky conference, as Simone described, and so I thought maybe we could talk about science.
Yeah, let's do it. What do you want to talk about, Selena?
Let's see. Well, we had two keynotes, which I thought were really great. So I'll start there. One was Steve Jackson, well known for his work on DNA damage repair pathways and for work that led to Lynparza. I think the thing that struck me most about that one was just the utility of that pathway outside of cancer. So these DNA damage repair mutations are driving certain ataxias. I think in neuroscience is a promising area. And even In repeat expansion diseases, you can get these somatic mutations, so we're learning in Huntington's disease, that develop over the course of one's lifetime and increase the length of a repeat and lead to symptom onset when there's a certain length of that repeat. And so that's a whole area that I think is not, it's new and it's really promising. It hasn't been super tapped yet. So that's one. The other one was...
Let me just, can I just interrupt there? Because one of the things that I thought was really interesting, and we will be looking at this, is the fact that, you know, you had Lynparza, and there was this expectation that they would uncover a whole lot of like pairs of genes that would be, you know, DDR, you know, pairs, and that hasn't yet happened. And so there's a sort of question, at the same time as it's expanding into other disease areas, there's a question as to why hasn't it even gone further than it has in a cancer?
Yeah.
Synthetic rescue, do you want to?
Well, I was actually going to give one fun fact that I learned from during Steve Jackson's fun, or like maybe more mind-blowing, at least what I thought of. But he noted during his lecture that that the DNA in every one of our cells is damaged in some way more than 100,000 times every day, and then subsequently repaired. And I'm still kind of trying to wrap my mind around that occurrence. So that really stuck with me.
Yeah, you know, my PI, when I did my postdoc, used to have what in England we call a badge, and you Americans call a button, saying, I know it looks like I'm doing nothing, but at a cellular level, I'm really very busy.
It's very good. Well, maybe on that note, on being active, we will take a break, we will come back, and then we can talk more science when we return. So hang with us.
BioCentury This Week is brought to you by the 12th China Healthcare Summit in Shanghai. From in-licensing to new co's, cross-border deals from Asia are transforming global biopharma. Meet top decision makers and investors at the 12th China Healthcare Summit to explore emerging opportunities and tackle key challenges in this rapidly evolving landscape. Join us in Shanghai October 22nd to 24th to get a first-hand look at China's dynamic life sciences ecosystem. Register and learn more at biocenturychinasummit.com.
And we are back, live here from Churchill College at the University of Cambridge. Before we dive back into the geeky science that I know Selena is dying to tell you more about, first, we have started, from our first few live podcasts, we've started something of a tradition of encouraging our guests, even sometimes our audience members, if they want to join in, to wear some colorful or extravagant socks to our show. Maybe I'll start off, if you don't mind. I can show the audience what I have. So I have Cambridge socks on my right side showing the punting in the Cam River. But having been someone who went to Oxford, I also have an Oxford sock on the other side showing the spires of the city. So kind of sitting on the fence, you know, trying to be polite.
Are you right-footed or left-footed?
Are Oxford socks allowed?
That's why it's on the left.
In Cambridge? I think we might have to evict you.
I'm trying to live in both camps. So, but maybe we can go around here and have everyone tell me what their socks are. Even though Simone shamelessly forgot to bring her socks, I do want to point that out explicitly. But maybe James, you can tell me what you've got going with your socks.
Yeah, I'm wearing my Canadian moose socks, an underappreciated animal, especially in Europe, but in Canada it's very much appreciated, and I'm Canadian.
Much bigger than you expect in real life, actually.
In real life, exactly. But the Canadian flag's on there just to fly the national colors.
Selena?
Science, like magic, but
Just
real.
That's good. That's good. And Michelle, what do you got going on with your sock game?
Yeah, so in jarring blue against my black and white monochrome outfit, I went for jazzy structure of DNA helix, which obviously was famously discovered in Cambridge, but also ably supported by the X-ray structures of Rosalind Franklin. And those of you who know, familiar with Aztec, structure is at the center of everything we do. So
Perfect.
They felt like a good choice.
Very appropriate.
I'd just like to defend myself here. Okay,
You can try.
I did forget about the socks, it's true, but I thought I'd show the nails, especially as I realized that they're actually in Cambridge blue. So there you go.
You have light blue.
Light blue nails,
That's
yeah,
good.
okay.
That's good. Okay, all right. We'll let you up. Anyways, let's return to our geeky science discussion. Selena, I think there were sort of two sort of keynotes that you had wanted to touch on. I'll let you talk about the first one, and then I abruptly cut you off. Why don't we carry on with the second one?
No problem at all. The second one was Sarah Teichmann, who showcased an example of the power of spatial transcriptomics. in resolving the cellular, at the single cell level, the complexity of an organ, in this case the thymus, and its molecular milieu and how it changes over the course of a lifetime, and relating that to the hallmarks of aging and to disease phenotypes. And I think James might have some thoughts on the aging panel.
The one thing that I found very interesting about that aging panel was the question or hypothesis that aging could be a driver of disease, and therefore if you actually interfere with the aging process itself, you may be able to have an effect of the disease. But in some ways, the real question in front of all of those scientists is aging simply correlated with the disease? And therefore going after the biology of the disease itself rather than aging is actually a more fruitful way to develop effective therapeutics, with the caveat that there may be certain diseases that truly are driven by aging, but most diseases tend to show a phenotype where they're more common the older you are.
Explain. So I think what those people in that field are saying is they're more common the older you are, therefore aging is a factor in those diseases.
I mean, one way to think about it is somebody says, I'm studying ApoE4 in the context of Alzheimer's because it's a risk factor, it's correlated. Nobody says, well, you shouldn't study that. They're like, that's obviously something worth investigating. So if age is an even bigger risk factor, it seems like it's worth the hypothesis. But I think the problem is that it's just ApoE4 is a very discrete entity. Whereas aging is this very complex thing that's not well defined, and how do you even go about it?
Yeah, exactly. And the idea of doing a clinical trial to slow down aging is a bit of a daunting thought.
Right. And I think they did stipulate to the idea that clinical trials on it is quite far off, right? But understanding the mechanisms of it. So if you're saying that we know that, I don't know, skin elasticity is one that they talked about, or various other things, are features that you uncover those pathways and maybe they reveal disease processes to you.
For sure. But something like ApoE4 may be important for Alzheimer's disease regardless of age.
Right.
That one is, it was just, yes.
I think what was interesting, one thing I noticed that they actually drew a distinction between the sort of term aging and longevity, right? So that, longevity being the goal, being to extend your life, which, as you pointed out, for clinical trials is very problematic.
Correct.
Well, James, I know you had some other thoughts from a few of the other panels. I think you maybe sat in on the obesity panel?
Yeah, Steve O'Reilly from Cambridge gave some really interesting thoughts towards the end of the panel on obesity, which was obviously very relevant to what's going on right now. The one thing I liked particularly was that he started to reframe how we think about some of these diseases. He referred to obesity as a neurologic disease because of the mechanism of action of the incretins being in the nervous system, particularly brainstem, et cetera, which is really interesting because it challenges us to think about the disease from its fundamental pathophysiology. The other thing he said, which I think is solely true, is that the skeletal muscle system is not simply a contractile organ, but a metabolic organ. This is probably also true of bone and other organs that we have that we think of in structural terms, but they have this big metabolic component that could be harnessed for new therapies.
I wrote down his quote was obesity is not a fat cell disease, it's a brain disease. And in a way that sort of taps back into what you were saying, that I think more and more we're sort of seeing diseases redefined or technology boundaries redefined beyond where we've sort of classically pigeonholed them.
The other thing I really loved about that talk is his idea of the thermostat mechanism. There's a homeostatic mechanism that sets your weight in a certain range. And whenever you perturb it, it wants to kind of come back there. So if you can unravel the biology of homeostasis, maybe you have a way into it.
That set point. I mean, similar to things like calcium level in the blood or body temperature.
That is, I think, kind of the holy grail of an obesity treatment. I think it's still, I think there's still some debate around obviously where that biology revolves, but it is definitely the dream is can you somehow adjust that homeostasis?
And sorry, going back to the dream and your parallel, he drew the parallel, right, with cardiovascular disease that in however many years, much as people just take statins or whatever now to reduce hypertension in order to offset all these other morbidities that come with high blood pressure, so it will be with obesity medications in, I don't know, James, how many years?
Yeah, whatever number of years, but it's the idea of being able to take something in a preventive way that's inexpensive and hence widely available, like a statin is, I think it augurs well for the eventual large population health of societies.
Yeah, and I think to do that, though, it needs to be more accessible, in particular around being orally available, and that really leads on to the small molecule panels that we had. That I think there's lots of work that needs to be done there. If you want to turn it into preventative setting, it's got to be orable. It's got to be much easier to get that patient compliance.
Yeah, actually for me, one of the highlights was the small molecule panel, and they also, in that context, discussed a little bit about what's the definition of a small molecule, even extended to, is a peptide a small molecule, and so on. One of the things that stood out to me in that panel was Lee Cronin from Glasgow. He was very interesting. And this was when the conversation went to AI. And obviously that's been a big, AI and genomics being big strengths, let's say, in the UK. And this was AI in the context of small molecule creation. And what was very interesting was that he was saying it's not only about coming up with that final molecule, it's also about the synthetic pathway to getting there. And so he drew this analogy by saying, like, if you go to Google Maps, it might tell you that route A is shorter, but route B, which is more circuitous, might actually be faster and better. And so it can be that AI is also helping us optimize the synthetic route. He's actually in favor of complexity because I think that protects you from an IP point of view. Or, I don't know what you'll have thoughts about
His
that.
comments on building ultimately complex molecules, I think, was very interesting because, and he said there really are two limitations. One is modeling out the complex molecule and its binding site onto a moving protein that has solvation spheres around it. But also the synthetic routes, as you point out, are also challenging. But the more we can unleash complex molecules into the pharmacopoeia, the better because of their specificity and effectiveness.
Yes. I would say it's not just about the IP, it's the specificity. Yeah.
I think the ability to potentially explore uncharted chemistry space, as well as using AI not just to get there quicker, but to get to somewhere different quicker, I think is really powerful and a really promising opportunity.
So from all of this, is the basic takeaway that small molecules rock? Is that basically the...
I think they were sort of really making the case, hey, listen, I know you got all these other sexy new modalities, but small molecules is still where money's at, kind of thing.
I do actually want to ask Simone a question. Was it on purpose that we had the biologics panel and the small molecules panel like immediately after each other? Because I almost thought it was sort of like a West Side kind of like Jets versus Sharks kind of thing where they were like, who's got the better modality?
UK versus France.
Yeah, yeah.
Well, we hadn't thought about it quite as antagonistically. We thought about it in the collaboration, sense, maybe UK-Belgium, to carry on a thread. So, yeah, it wasn't a coincidence, but we had not really pitted it as needing to defend your turf.
Fair enough.
And in a similar way that we talked about, global collaborations geographically, in the end, really effective medicines rock.
Yes. Good point, James. Good point, James. So, we obviously had lots of other great panels and sessions here, including we had a fireside chat where Simone sat down with AstraZeneca's Sean Grady. James, do you mind just sharing maybe a thought or two that you had about that chat?
It was so great to see Sean. I've known him for years in his BD capacity, but now he's taken a job as chairman of the UK for AstraZeneca, and he dropped a zillion names. And because he's such a good guy, he then had to apologize to the audience about hobnobbing with the royals and bumping up against kings and Macron and all that. But then he made a really interesting comment, was how AstraZeneca, as it reformed its pipeline, not only was it acquisitive, did many collaborations to bring in new molecules into the company, but it also had to get rid of some of the molecules that were at the company in order to make room for those. And that's a really important point, I think, for every large company, most medium-sized companies, and even small companies to take into consideration.
I can chip in. I think, one of those themes is collaboration. And, I think there's been a lot of talk about collaborations here at these sessions today and yesterday. And, Astex has always done a lot of collaborations with pharma companies, with biotech companies, with academia. And it's a really great way of bringing new science and innovation into companies. And I think, Sean talked about that. And I think it's important for all companies to really be looking out there to explore the best innovations and securing the best science to take forward. And it's not about, this not invented here mentality can be very strong. And I think that's something that all institutes need to be really careful of.
Taking the collaboration thread and going back to the sciencey bit, what we had the panel on biobanking that Selena moderated very well. And obviously genomics is a big part of Cambridge and the UK's strength. There's a little bit of a common thread for me here as well. We've talked about, in the sort of same sense as the small molecule, like part of the part of the status appears to be mapping this path ahead. We sort of have a sense of what the technology can do, but now we understand that we have to, lay down those Google Maps, as it were. And, there was a comment on the biobank panel about creating risk prediction models and quantifying risk. And I felt that this is part of the journey by which, the UK Biobank is already delivering and you might have used it actually, James, in your companies, you might talk about that. So it's already delivering things, but we've got Our Future Health as well. And we have this sense that there are these data lakes. And I think we're moving beyond the just constructing data lakes to starting to work out how to interrogate them. And as I said, create those pathways. And I'm hoping in grand rounds in I don't know how many years, we'll start to be talking more about the fruits of them. And what are your thoughts about that?
So the mantra of human biology and drug development has been, said over and over at all of these conferences we've been going to for a decade. I think the thing that struck me really, which I said on the panel, I'll just repeat it here, is that you have the scale of the data is really increasing right now. You have the layers of the omics also scaling and becoming available. You have much better tools for measuring these different kinds of analytes. And this is all happening at the same time that we're having this AI revolution. So yeah, we may be, hopefully, maybe approaching some sort of a tipping point where actually the promise of human biology and drug development, which is to increase success rates in the clinic, actually starts making a difference in like a larger scale,
I think there's a real opportunity for human genetics to not only inform the natural history of a disease, and that's been what many of these biobanks have been focused on, but even more importantly, and this was touched on in the panel, the treated history of a disease. Because now that we have many therapies, thinking what are the genetic elements that would predict response, predict resistance, these kinds of things over time in the treated history of the disease, there's some real opportunities there.
Yeah.
Wonderful. Well, I think just maybe one final thought before we wrap up here. Obviously, I know, James, you and Alex Schuth from Denali, you guys had a very wonderful panel with also a partner from PJT.
Moderated by me. Is that what you're pointing at me for?
Wonderfully moderated by Simone.
Okay.
I was actually hoping you might insert the name of the PJT partner. But I thought it was very interesting. There are a couple quotes that I did sort of jot down that I thought were quite fun and maybe a fun way to end on. So, James, you had a comment that some, maybe more than some deals, are pulled out of the toilet at dinner meetings, which I thought was sort of an important reminder of the personal connection and the trust that you have to build with prospective partners?
Yeah, and until you actually get deep into business development, either on the buy side or the sell side, you think of it as a highly analytical process about valuations and negotiations, and that's a very important part of it. But there's this very human part of it, which is developing trust and a relationship with the company. And that can take months, years to do sometimes. And dinners are one way to do that, I think a very effective way, and a tool in the effective BD professional's bag.
Yeah, and I think you also touched on the fact how important it is to have a champion in the other organisation, and that really mirrors our experience as well. Having a champion on both sides of the deal is really important for the deal success.
And then finally, one final quote from your panel, which I'm going to be totally shameless about. Alex commenting on that if you want to know about your prospective partner, what should you do, Simone?
You should read BioCentury.
That's right. That's what he said. So on that, I think we should bring this to an end. Thank you all for joining us today. Thank you to our live audience for being here for the special edition of the BioCentury This Week podcast. Thanks to all of our listeners for tuning in. We will catch you next week, wherever you get your podcasts, or in the case of our audience, next year for Grand Rounds 2026 US in June in Seattle. For Grand Rounds Europe next September in a as yet to be disclosed location. Also, hold on, the BioCentury This Week podcast, we will be back on the road later this fall, November 19th in London for our third Biotech CEO and investor reception during the London Life Sciences Week. The exclusive gathering will have some live music where I am told that Simone will be singing. Is that right, Simone?
No, so not.
That's not right. Okay, maybe that's still under negotiation. We'll figure that out.
I charge a lot more for that.
I think we should be, anyways. In any case, We'll also have a live recording of the BioCentury This Week podcast, great networking opportunities. So join us, the BIA, Pioneer, Precision Biosearch, and other distinguished guests for that exclusive event in November. To request an invite, please email conferences@biocentury.com. Thank you again for joining us, and we will see you next week. Thank you.
Kendall Square Orchestra provides the music for BioCentury This Week. The group connects science and technology professionals and other members of the greater Boston community to collaborate, innovate, and inspire through music while supporting causes related to healthcare and education.